What we permit, we promote. What we walk past, we accept. When we stay silent, we condone.
Incivility in academia undermines collaboration, erodes psychological safety, and can significantly hinder individual well-being. Today, we uncover the role of leadership in modeling and sustaining civility across academic and clinical settings. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. In a world where you can be anything, be kind. Did you know that nearly 60% of nurses report experiencing incivility in the workplace? Today, we're exploring a topic that's not just timely, it's transformative. We're talking about civility in nursing, what it means, why it matters, and how we can reclaim it in both academic and clinical settings. Joining us is the incredible Dr. Cynthia Clark, founder of Civility Matters and a professor emeritus at Boise State University. A trailblazer in the field, Dr. Clark has dedicated her career to creating healthier and more respectful work environments. Her work has inspired change across 5 continents, and today she's here to spark change with us. Welcome, Dr. Clark.
Thank you so much, and greetings, everyone. It's such a pleasure to be part of the Lippincott Spark podcast series. I've been really looking forward to it. I want to thank you and your team for inviting me to speak, and the listeners for joining us. So thank you so much.
You're welcome. I'm very excited to talk to you today. So let's begin by grounding ourselves in the heart of kind of today's conversation, which is civility. It's a word that we often hear, but what does it truly mean in context of academia and in healthcare? So I'm wondering, Dr. Clark, if you can begin by defining civility and explain why it's so important, why civility and respect in nursing matter.
One of my all-time favorite questions, of course. It's a question actually I've been attempting to construct and deconstruct over my decades-long journey to explore this concept, to understand its meaning, and to share that with others. So if we go back in time for just a moment to 2008, which was many years ago, of course, my colleague and I published the first concept analysis on civility in nursing. And our goal was to gain some clarity around the concept, as well as develop an operational definition. And then during the pandemic, I became really curious about, I wonder if this concept has changed over time. Has the meaning of civility changed over time? Because as you know, our listeners know, that concepts aren't static, they evolve. And so I assembled a research team to revisit the concept and to do a comparison. And we updated the concept analysis in an article published in Nursing Outlook. And it was awesome because we had scholarly works from, I believe it was around 17 countries representing 10 or more disciplines. And here's what we learned, that actually the concept hasn't changed a lot over time. It still is about how we choose to relate to people and interact with them. And we learned that civility is not exactly the same as respect, but it's very similar. And we learned, as I said, civility is a choice. It's a decision we make every day with every encounter, with every interaction. It means that we show respect for the dignity of others. We create work and learning environments where people feel like they belong, they feel welcome. And we foster civility through a sense of belonging, and it helps us create space for connection, and perhaps especially when we disagree. Last thing I'd like to say about that, because some people have a lack of clarity around the idea of civility being about liking. And I want to say it's really not relevant to liking. So In other words, we don't have to like someone to treat them with the dignity and the respect they deserve. Now, if you and I work together, for example, we like each other, that's awesome. That's a bonus. It's not required for us to treat one another with respect.
That's such a powerful foundation. Let's explore how concepts actually show up in real world behavior. So, can you describe a little bit for our listeners about the behaviors displayed along that continuum of workplace, say, aggression, and how these behaviors manifest maybe into the healthcare setting? What are you seeing out there?
Oh, totally. Yes. So, again, many years ago, I started on a journey to create a continuum that would help us understand and illustrate the various behaviors that can exist along a continuum. So, if we think for just a moment about any continuum and we go to the left side of that continuum, as it relates to workplace incivility and aggression, on that left side, we're going to see less disruptive forms of uncivil behaviors. Those will be things that kind of niggle us, they bother us, maybe they're a bit disruptive. Then, if you will, for a moment, let me take you to the far right of the continuum. And that's where we see some horrific kinds of things like actual acts or threats of violence, tragedy, say something horrendous like a campus or a hospital shooting, and then everything in between those 2 points on that continuum. And so, if we go to that left side for a moment, and we think about, for a moment, nonverbal behaviors. So we're not saying anything, but we're demonstrating certain behaviors. And those might be things like finger pointing, eye rolling, arm waving, walking away before a conversation is over. And by the way, I'll mention here that a few years ago, a group of physicians published a paper where they were looking at what are some of the uncivil behaviors that are occurring in the patient care settings and their impact on, say, worker and patient safety. And it was so interesting because one of the top behaviors, in fact, I think it was the top behavior that they were seeing, was a nonverbal whereby colleagues were just walking away from a conversation before it was over. So they said absolutely nothing, but they're just walking away. Now, when I think about that, let's say that you and I work in an accounting office. And you approach me with a comment or an idea, and I just walk away without saying anything. Now, you're probably going to say, wow, that was unfriendly. That might even have been rude or dismissive, but chances are nobody's going to get hurt. If we put that same behavior in the context of the patient care environment, now we have really ratcheted up the danger. People can get hurt. Errors can be made. So much can happen. And that's why I wanted to start at that far left of the continuum with the simple nonverbal, because depending on the context, it can have very dire consequences. Now, in between those 2 points of, say, uncivil, rude gestures that are nonverbal, all the way to, say, acts of violence, what are some of those things in the middle? Well, let's talk about some overt behaviors for a moment, things that can occur in a work environment or a learning environment, spreading rumors, negative gossip, pitting colleagues against one another. In some of my work, there have been narratives and stories written about faculty having students gang up on other faculty or dismiss other students. So it's such a messy situation in some cases. But we see name calling, making demeaning or belittling remarks, putting us down for any number of reasons, our race, our ethnicity, our weight, age, gender, religion, you name it. Those things can happen. And as I mentioned before, incivility and these other acts of aggression are not only what we do, but what we don't do. When we stay silent, when we don't advocate, when we withhold important information, all of those things can make a difference. And I'll name just a couple other things along that continuum. There are many behaviors, but I want to draw our attention to bullying for a second, Because when we think about bullying, one of the definitions that I often ascribe to has to do with bullying behavior is a repeated, persistent pattern of abusive behavior. And it's characterized not always, but almost always by a perceived or real power differential. And the outcomes often are intimidation, degradation, humiliation, and it's been described by the Workplace Bullying Institute, by the way, as analogous to domestic violence at work. I also want to mention two more. One is a subgroup of bullying, and that's cyberbullying. And this is getting much more traction. The use of digital devices to, post some really horrible things sometimes, harmful, false, or malicious content, sometimes serious enough to be considered criminal. And it's really, really hard to address, right? Because it can happen anywhere. It's out of view. It's anonymous. I've worked and talked with many people who had no idea that there was a sort of cyberbullying experience going on, including mobbing, which I often call bullying on steroids. This is a soul crushing experience where there's a collective or group activity where people within a workplace, for example, collude to diminish another person. Things like psychological terrorism, social piling on. So it's pretty awful stuff. And it can certainly create a toxic work environment.
I'm taking a deep breath here because it's like, wow, this is happening between student to student, student to faculty, faculty, even administration. And I remember in 2020 with COVID, it was my first nursing meeting. I come on and we had a big faculty meeting, and it was quite interesting because the individual who was speaking asked for, her colleagues' opinions. And when there was a difference of opinion, she muted the person. And it was seen as disrespectful, uncivil, and it was very interesting. How will the leader respond to this? Will they condone the behavior? Did they see it? Meanwhile, there's 50 other people on the call, seeing this happening. It kind of reminds me that the key is understanding these behaviors and, really looking at the ripple effects on how it can impact our nurses and, as you mentioned, the kind of the care that they provide. So what are you seeing are the immediate or long-term impacts of incivility on, I'll say, students, nurse educators, academic administrators, and then, of course, like you said, ultimately patient care?
Yeah. Because that's really the crux of the matter, isn't it? The kind of impact and how those behaviors are perceived. Certainly perception is an issue, but the data is pretty clear. And before I jump into that, I want to make a comment about your comment. There are, I don't know if we call them sayings or quotes, but we'll often hear related to what you were just saying is that what we permit, we promote. What we permit, we promote. What we walk past, we accept. When we stay silent, we condone. So much of the impact on culture at large and the toxicity that can occur. If we look at some of the groups you just mentioned, if we think about students, first of all, these impacts that I'm going to mention very often cross over to all those groups. So for example, if we think about the emotional, psychological, and physical toll that these behaviors take on students, they're very similar to those that they take on faculty, let's say. But think about what I mentioned before in terms of the power differential. There will always be a power differential between faculty and students to the extent that they are learners and we are facilitators of that learning. So we need to be very cognizant and intentional about our interactions with our learners. I often talk about how we take a trauma-informed approach in our teaching pedagogies and other teaching strategies. But the emotional and psychological, physical toll can be extreme. Stress, anxiety, burnout, emotional exhaustion, things like headaches, stomach aches. I've had students in some of my research and sometimes when I've met and talked with them saying that they're vomiting on the way to their clinicals. So there can be some real difficulties. We also know it impacts their academic performance, their clinical expertise, and there's so many more. But I'm just kind of cresting the waves a little bit here, thinking about faculty, same. It takes that emotional toll. It also impacts our performance. We're likely, if we're treated in ways that might be considered rude, uncivil, disrespectful, it's likely to have an impact on how effective we are as educators, our work performance. It's going to inhibit our ability to create positive learning spaces and environments, strained relationships, and it's going to have an impact on our career. Not too many of us want to stay in a joyless work setting. And then let's jump very quickly to patient care. So, nurses in the environment, and then the impact on care to our patients and patient safety. The link between stress, incivility, impact on patient outcomes is well documented. For nurses and other healthcare colleagues, what we're going to see in detrimental impacts, again, is stress. We are more vulnerable to physical and mental health conditions, exhaustion, absenteeism, greater resignations, impaired performance, decreased clinical judgment. I could go on and on and on because we know that there are some linkages there, certainly not cause and effect, but having an impact. It decreases job satisfaction, morale. And think about this, because for those of us and our listeners who maybe have experienced some of these behaviors, we often take them home with us. That has an impact on the people in our lives, our family, our loved ones, our spouses, our children, our friends. And as it relates to patient safety, the relationship between uncivil and aggressive abusive behaviors and poor patient outcomes is very well documented. It can result in life-threatening mistakes, med errors, treatment errors, delayed care, near misses, harm, or death to a patient in some cases. And then the last thing I want to say about this, we're learning more and paying more attention to the impact that these behaviors have on those who are not targeted, but who witness those behaviors. And witnesses often will describe feeling anxious or stressed out, or they're feeling very guilty that they didn't speak up. When I get into workshops and really working with people, what I learn is that most of us want to speak up. There are reasons that keep us from doing that. And one of the reasons is that folks feel ill prepared to deal with those situations and don't really know how to intervene. So that's really an area ripe for study and intervention.
As we turn kind of our attention to those proactive strategies and institutional approaches, like you said, a lot of people feel ill prepared. They're not sure how to handle this. What do they say? And, I think, in my opinion, leadership is the key, but so is preparation. And one technique I know you've championed is cognitive rehearsal, which I absolutely loved your article on cognitive rehearsal in 24, and really giving, faculty and staff or students an opportunity to prepare for and respond to uncivil encounters. Can you kind of dig into that a little bit? Because I'd love to hear kind of your take on how that strategy came about and what you're seeing in terms of its use and outcome.
I super, super love this question. So again, let's go back in history just a moment. There was a beautiful sentinel work published by Dr. Martha Griffin back in 2004 in the Journal of Continuing Education in Nursing. And I was in my faculty role at that time. I read the paper. I'm like, oh, this is what I'm about. So literally, I've been inspired by Dr. Griffin's work. This is something I've been doing now with students, groups, physicians, faculty, you name it, for the past 20 years, since 2004-5, after reading that article. And let me just say here for a moment, when I think about that, I really started doing cognitive rehearsal even before that in my clinical experience as a young mental health professional, as a nurse therapist, because we were doing psychodrama with violent youth. So my background is adolescent mental health, and we were doing what was then called psychodrama, where the clients, the adolescent clients, in a controlled environment with excellent therapists, would have the patients or clients role play some of their violent acts, and then we would help them intervene. So that's why I love this question. So back to it. I would consider this my signature pedagogy when really getting into the weeds with people. So cognitive rehearsal is an evidence-based technique. It's based in behavioral science theory. And essentially what it is, it's where a skilled facilitator, i.e. myself when I'm doing it, works with individuals and groups to help them role play, practice, rehearse. That's where the rehearsal comes in, to address stressful situations in a safe, non-threatening environment. The goal is to, as we role play these experiences, and most importantly, do a deep debrief of the role play, it's intended to create a situation where if we are faced with similar events or encounters in the future, we're better equipped to deal with them because we have dealt with them in a therapeutic, if you will, non-threatening environment. So there's lots of steps to it. If people are interested, maybe we can do a separate podcast on that, but it's just excellent in terms of helping people really master some of those skills.
I just really, really appreciate the strategy because I think as you're thinking about that anxiety producing or self defeating situation, and like you said, if you're feeling ill prepared, by rehearsing kind of effective, like you say, behavioral and kind of verbal responses, can actually, I've experienced by using this strategy, there definitely is a positive effect on kind of your interpersonal skills. You have increased confidence, your impulse control, because you want to just, you get a little defensive and you want to jump in, but by having that pre-briefing and that role playing and even using those scripts, I found that really helps to decrease that anxiety. So well done. I love it. And yes, we should talk about this more.
It's an excellent technique. I do highly recommend that if folks are thinking about cognitive rehearsal, that they really become well schooled in the techniques, debriefing strategy, the whole array of steps, because it really takes a highly skilled facilitator.
Absolutely. Because if this is creating a lot of anxiety and, if I've experienced incivility and bullying and to the point where it physically makes you sick or your hair's falling out, your nail beds are getting, ripply. It's just like all of those physical things that you mentioned earlier in the podcast, that as you're talking to that individual, focusing how that behavior affects, the team performance and keeping your tone constructive and very solution oriented. And I have found this to be very, very helpful. So thank you for bringing that to, our listeners' attention and for publishing on that, because it's so very important. I'm wondering if you have any other real world examples that kind of illustrates the impact of incivility in nursing education. Do you have any examples or things that you've run across in your career that you'd like to highlight?
Enough to fill a book or more. But
yes.
So I want to take us back for a moment. Remember the continuum that I talked about mobbing, where we see a collective bullying or that collusion. So I want to tell a real life story about workplace mobbing among faculty. And this story was told to me some years ago. I've never forgotten it. As I tell the story, I want our listeners and you, of course, to kind of consider who shared this story with me. Which of the characters in this real life true story brought the story to my attention? Okay? There once was this very gifted and talented nursing professor. He was very well liked. His colleagues respected him. His students loved him. He had received lots of awards for outstanding teaching, student advising. He was the whole Monty. Well, for some reason, he was very much disliked by the director of the program. And that person seemed to take great delight in writing him up on a routine basis for what she called poor performance. Now, the professor, this gifted, talented professor, thought the write ups were false. And they continued nonetheless, even though he would try to have conversations. He finally went to the dean and he said, I want you to help me kind of look into this. Is there merit here? What's going on? After the dean reviewed everything, the dean agreed, yeah, these write-ups really don't have evidence to support these write-ups. And so the dean asked the director, pretty much cease and desist. If you have something credible and backed by evidence, of course, let us know, but otherwise, let it go. But the director didn't want to let it go, had a very different idea. And here's was her idea. She decided that when she wrote these up, rather than just simply sign off on these performance issues herself, she enlisted the entire core of the leadership team to sign off on them as well. This
Oh,
is a
wow.
true story. Isn't this horrible?
Wow.
And so that if it was ever called into question, the director could say something like, hey, it's not only my observation of poor performance, my entire team signed off on it. So as you think about that story, and I'm going to wrap it up for you too, kind of tell you what happened. Who do you think told me the story?
It could come from many different perspectives, right? It could have been from the dean's perspective, the student's perspective, of course, the individual faculty, of course. You got me stumped.
It was one of the members of the leadership team who signed off
sure.
on the bogus performance.
Oh, and was a contributor to that. Mm-hmm.
Because once I processed with that individual and they told me what had happened, we finally got to the point of me asking, hey, what motivated you to sign off on that? And as some of our listeners are probably already thinking, is essentially I went along with it because it's better him than me.
Sure.
I don't want to be on the receiving end. So I'd ask the listeners to think about, what do you think happened to that gifted and talented professor? And guess what? He left. He left the program. They lost one of their rising stars, their top performers, largely due to this mobbing experience that occurred. The person who told me the story, guess what that person did? They left as well,
I was going to say, now you lost two.
feeling guilty about participating in the sham. I sometimes will tell that story to think about how many casualties of this senseless example of workplace mobbing. So, true story, horror story, sad story.
To close, we'd love for you to share a final spark, kind of a pearl of wisdom or a key takeaway or inspirational message for our audience. Do you have a final spark for us, Dr. Clark?
Oh gosh, so many sparks. But and by the way, I love the title of your podcast, The Spark.
Thank you. Thank you so much.
So I would say that everything we've talked about today, if we're going to create healthy work environments, learning environments, it takes all of us. When we work together, all of us benefit because inclusive cultures really cultivate respect, places of joy where our voices are heard. So I'm going to say that my spark is with all of us coming together, collaborating collectively, we can create communities of shared purpose and spaces where our learners flourish, where workers find joy, and where together we can create great things. So thank you very much for this opportunity.
Thank you so much, Dr. Clark. I think of what a powerful conversation, from defining civility to exploring potential solutions with cognitive rehearsal. You have reminded us that respect isn't just a value, it's a practice, right? One that shapes how we teach, how we lead, how we learn, and, how we care. If this episode sparks something in you, share it with a colleague and explore part 2 of this topic to help you lead with civility and courage. And until next time, keep that spark alive and let's build a more compassionate future together. Thank you again, Dr. Clark.
You're so welcome. Bye, everyone.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.